I want to bring in now Mercedes Carnathon, professor and vice chair of preventative medicine at the Northwestern University Feinberg School of Medicine. Her research focuses on the epidemiology of cardiovascular disease and lung health in different populations. Thank you for being with us. I'm anxious to hear your perspective, especially we heard Mike Memoli enumerate what President-elect Biden's priorities are going to be. What would you say needs to be his priority when he takes the reins in 19 days?
I think the priority, in my opinion, needs to be on reinforcing the basic messages that we know about how to stop the community transmission. As we're well aware, our strategy for vaccination is starting with shoring up our infrastructure of healthcare workers. However, this isn't necessarily the population who is leading to the community spread of the coronavirus. And in particular, this new variant that has been identified in 3 states, 2 of which are 2 of our largest, most populous states in the country, we can be sure, based on the photographs that we all saw from TSA checkpoints over the holidays, that millions of people traveled among these destinations. So we can be fairly confident that this variant is now everywhere, and this variant appears to affect more adults under age 20. And I think the reason why that's particularly critical is that this younger adult population is circulating more. They are performing some of the essential roles such as delivery work, factory work, and they're just generally out there in the population. And that population isn't in line to be vaccinated soon.
So clearly, from what you're telling us about this variant, that is a concern. But how tough is it, considering this time, the holidays, hampering our ability to get a full picture of this and vaccinations as well? We all know about, the spreaders here that can happen with small groups gathering. As we, fly into the new year blind about this, what would you say is what people need to know about this?
What people need to know, and I'm struck by President-elect Biden's focus on FDR. We are in the middle of the war still. Yes, the U.S. has entered this war. We've got a vaccine ready to go. What a tragedy it would be if we let down on our behaviors at this point in this war and let this continue to spread. How many more people are going to be infected, hospitalized, experience long-haul COVID, or die when they could have been next on the list for receiving the vaccine? The focus right now, particularly given what we saw over the holidays of people gathering, people traveling, needs to be on reinforcing those responsible behaviors that we know can prevent the transmission of the virus. To have so many more people affected, healthcare workers exhausted at this point when we're so close to the end. Help is coming. We just still have to do our part.
Yeah, you're saying this is a war, and one of the biggest battles we're seeing is in L.A. County. Parts of Southern California, their doctors and nurses say they can't take much more. In some cases, quote, hospitals have built makeshift ICUs and they sometimes move patients into shops or pediatric wards to care for the sick and dying. We heard reports of some ambulances having to wait 7-8 hours before they can even unload their patients to get treatment there. So we've heard of warnings of a dark winter here. So is what we're seeing in Southern California and L.A. County a warning of what could come in the next few weeks nationwide after the holidays?
I think certainly, one of the patterns that we've seen throughout this is that there happen to be surges in given regions and cities for reasons that may or may not be clear, but we see these peaks and waves. In late November, we had that situation going on here in the Illinois region. And so what we're seeing in Los Angeles could be a harbinger of what we're going to see in other regions of the country. And you mentioned the space issue and the makeshift hospitals. Those are infrastructure issues that can be addressed by opening up field hospitals. What cannot be addressed is the need for experienced and trained personnel to be able to manage these individuals. I'm very pleased that we have an opportunity to protect personnel right now. However, I have heard reports of some individuals delivering the vaccine in their roles as pharmacists and technicians who have themselves not been vaccinated because they haven't received a priority for vaccination. And we need to protect those individuals so that they can help to keep us alive and to continue to protect us. But yes, I'm very concerned that what we see in Los Angeles is what we're going to see in other areas as January and February continue.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me or click over on this list to see lots of other great videos.